to City Highlights. We have been talking about a number of gynecological problems. My guest is an advanced gynecology specialist. His name is Dr. Othman Kadry, and he has been talking about some innovative procedures that he has been involved in for the last 15 years that really reduces the type of pain that people have when they go through a lot of gynecological operations. And so he's got some new methods that he has been using for the last 15 years. One of his patients is Montez Miller, who happens to be my producer for City Highlights, and she has had an opportunity to actually experience one of these innovative operations, and so we thought that what's being done with Dr. Kadry's patients is so phenomenal that we needed to share it, and so that's why we're doing it. Montez, welcome to the other side of City Highlights.
I'm so used to being in the control room. I'm not used to being in front of the cameras, but I felt that this matter here was so important to me, especially after experiencing it. I just felt that it was important for me to get the information out into the community, and mainly to African American women who is most affected by fibroid tumors. I went through several doctors. The story goes, I went through a few doctors. Girlfriend number one went through the procedure, and she had the most abrasive procedure done, and all she ever did was complain. Oh, it hurts and it hurts, and it took her like 6 to 8 weeks to heal.
Recover.
Right. And then a couple of weeks after that, girlfriend number two went through the same procedure, and she came in like a spring chicken, like nothing never happened.
You said, I want to go to that doctor.
Right. So I had started out with girlfriend number one doctor, but then after seeing the results of girlfriend number two, I said that if I were ever challenged in that particular area, that I would go and visit girlfriend number two doctor, which ended up being Dr. Kadry. And the procedure,
now you had fibroids removed.
I had fibroid tumors removed, and of course, that was the first time that I ever been on the table, never been in an operating room, didn't know what to expect. And when you have all these fears, you know, it just brings amongst other things, and it's phenomenal. I'm like speechless right now. I can't even find no words, because I went on this emotional roller coaster thinking it was going to be this and it was going to be that, and I explained to Dr. Kadry that I'm a television producer and I just can't be down. I can't afford to take any time off, and they assured me that I could go right back to work.
I'm going to tell on her right now, Dr. Kadry, because I believe it was the very next day after surgery, Montez called me, and she's whispering, and she's like, I can't believe this. I feel great. I feel like I could go back to work today. I'm not supposed to be talking on the telephone, but I just wanted you to know that I feel great. Literally, within less than a week, this woman was ready to go back to work. Now, I don't know how significant her fibroids were, but this is the first time that I have ever seen someone undergo this type of surgery and bounce back so quickly.
Could you allow me to talk about her situation? This is an example. By chance, she is the patient now, and this is a real case. You know, when you ask me about the big, her uterus is very big. I would say easily equal to the size for a term, what we call 16, 17 plus size uterus, weeks, big. In addition to this, she has adhesions, and even the fibroid bush on the bladder. And if any gynecologist listen to this, he knows what he means. Plus, even worse than this, there's a ureter between the kidney and the bladder tube, what we call the ureter, very dangerous if we hit that ureter. The urologist, which I hate to say, he tried 1 hour to insert a stent in the ureter. He could not insert in her ureter, and that, can you imagine how difficult? He could not do it. And even in the middle of surgery, I have to remove the fibroid, dissect it, and also I have to dissect the ureter, dissect the bladder, and remove the uterus entirely through a minimal invasive method like what we mentioned. The blood loss for her case, you will be surprised, less than even 50 cc of blood.
Wow.
Even we have to dissect the ureter. She didn't know what I was doing. This is how difficult her case is. Next day, when I saw her around 11 o'clock, she was walking in the hallway, and I don't know what I was going to tell you. She looked like she already make her phone calls, and she ready to go home 11 o'clock in the morning.
Right.
This story is not even unique.
This is typical
Almost
of
typical.
what you see with your patients. The laparoscopic surgeries that you performed are not widely practiced in the state of Michigan. You really have to do your homework if you're looking for someone like Dr. Kadry. We wanted to again share information about this unique surgery because it's an alternative. Montez is doing well, girlfriend number 2 is doing well, and we think that it's important enough that we share with you that you have options out there, and particularly as it relates to women who have numerous fibroids, and you're wondering, how do I get them treated? And so this is yet another option. One of the things that we're not going to talk about is, even though this is a new procedure, there are yet some new things that Dr. Kadry has developed to coincide with the surgeries that he continues to perfect. And women like Montez are so much better because they've had an opportunity to have him as their physician, as their gynecologist. Dr. Othman Kadry, again, an advanced gynecology specialist of Michigan. We thank you so much, Dr. Kadry. You'll have to come back. We know that a number of you all have questions, but I want to thank you for having joined us on City Highlights. And Montez, I want to thank you for sharing your personal story with us, with the hope that more women can take advantage of these new procedures because they do work.
I mean, it's pain-free. I mean, I didn't feel any discomfort at all, and what more can you ask
You're on the
for?
mend. I think both of you all have enjoyed.
Thank you very much. Thank you.